Have you ever felt so stressed or overwhelmed that it was like the world around you was just rushing past in a blur and you were stuck in the middle in your own little bubble? My name is Dr. Emma Cernis. I'm an assistant professor of clinical psychology at the University of Birmingham in the School of Psychology and the Institute for Mental Health. And my research topic is dissociation. So you might have heard of maybe multiple personality disorder, which is now called dissociative identity disorder. You might have heard of depersonalization, where people feel disconnected from themselves or the world around them. Dissociation has been used as a term to describe a whole range of very different experiences, including the one I just mentioned. And that's because we think that many dissociative experiences exist on a spectrum of severity. So what that means is it's very normal for any of us to experience them sometimes. For example, you might have felt like the world was a rushing blur going past you super fast while you were stuck in the middle in a bubble, maybe after a bad night's sleep, or jet lag, or after a really stressful day, or some bad news. And for some people, if they're very hungry and have low blood sugar. So these experiences are normal, they're nothing to worry about. But for some people, they can get stuck and they can persist. And perhaps they could become more extreme versions of this so that they really are quite upsetting and quite problematic in their own right. My research wants to understand how that happens and what particular psychological mechanisms or factors might be underneath this. The reason I want to know what factors might cause the stuckness or make it a problem for people is so that we can target psychological therapies. So talking therapies like CBT, cognitive behavioural therapy, work by knowing what keeps a problem stuck. For example, if we found out that worry was one of the reasons why dissociation might persist for some people, then we could do a talking therapy together where we could think about reducing or managing worry. And what we might expect to see is downstream, a later effect would be that the dissociation also reduces because the worry isn't there anymore to keep it stuck. My research is thinking about this and thinking about how we can develop a targeted psychological treatment. At the moment, I'm still in the stages of understanding exactly what psychological mechanisms might underpin dissociation, but soon I'll be taking part in some pilot therapy cases to test out some of these new ideas, including the one about worry. So through my research, I'm really hoping that in the long term, we can make a difference to people who are experiencing dissociation in a way that is upsetting and that does persist, so that we can make things a bit easier for them. Thank you for listening.